I'd like to tell you a story about how point-of-care ultrasound in my first week of fellowship helped me diagnose a potentially limb-threatening injury and expedite the care of a teenage boy. He presented 2 days after a pretty trivial injury to his right groin. He'd been biking downhill, out of the saddle, and braked suddenly, falling forward against the handlebar. He didn't fall off the bike and was able to keep riding. That evening he complained of pain to his right groin, where the handlebar had dug in, but this was dismissed as there was no external bruising or swelling. Over the next couple of days he noticed that his right foot would intermittently turn cold and pale whenever he flexed at his hip. He walked into the emergency department quite comfortably, and on exam, sure enough, as he flexed his hip, his foot would immediately go pale and cold. And the pulses, although they were present on that side, they were diminished compared to the left. We know that handlebar injuries have the potential to cause very serious injuries that, because of the trivial mechanism, often present late or are misdiagnosed on initial presentation. On my differential was either a vascular injury or something like a psoas hematoma compressing the artery. Although I had never used ultrasound for this specific application, I was familiar with the anatomy from femoral access and DVT scans. I chose a linear transducer and placed it initially just distal to the inguinal ligament at the mid-inguinal point. I identified the femoral artery lateral to the vein, and as I scanned over the point of maximum tenderness, I could see echogenic material within the artery. And as you can see, there was reduced flow with colour Doppler, and there was no free fluid or collection seen adjacent to the artery. My findings of right femoral artery thrombus were confirmed on comprehensive ultrasound, and the thrombosis team and vascular surgeons were consulted. He was started on heparin infusion and was later taken to the OR for thrombectomy and went on to make a full, uncomplicated recovery. A further delay in his care may have been detrimental and could have caused permanent ischemic loss of motor function. This application is within the scope of all emergency physicians performing point-of-care ultrasound, and as recently highlighted by Stoltz et al. In West Journal of Emergency Medicine, not performing POCUS examinations or not performing them in a timely manner may put you at risk of a potential malpractice lawsuit.